I am Dr. Lisa Indar, the Interim Executive Director of the Caribbean Public Health Agency, CARPHA. So my role here, CARPHA is the Regional Public Health Agency, and my role here is about, putting health in tourism. COVID-19 taught us that health is important for tourism, and so we at CARPHA has regional tourism and health program, another one, nowhere in the world it's been done, where we are putting in place systems of, reporting and standards and operational mechanisms so that we're able to identify any public health threats to tourism and nipping it in the bud very quickly so that the health and safety of our visitors and by extension our local population is safer. In terms of the three factors, I would say one would be, obviously accessibility and affordability. That is important because, coming to the Caribbean, as say coming to Mexico or another place, it is more expensive. So you need to have accessibility and affordability for growth. The other thing about growth is that you need to have resilient tourism. You have to have sustainable or resilient tourism. So therefore, whatever packages we're offering should be more resilient, should be more affordable. So that requires then visibility, harmonization, the type of packages that the tourism sector is offering. What is different for the Caribbean? What is the experience that is different, say, compared to going to another destination, a Latin American destination than as opposed to the Caribbean. And third, I must put this, health. You want to ensure that if you're coming to the Caribbean, you want to have a healthier, safer experience. So if you remember during Zika and, persons say not to come to the Caribbean because of risk of pregnancy or with COVID and all of that, you want to ensure that people who are coming to the Caribbean are having a fun time but also a healthier time. So for me, on the health side, of course, the ministers of tourism, while I work with the health ministers, I want to work with the ministers of tourism. I want to work with the tourism authorities. And finally, the tourism entities themselves, the hoteliers, the cruise ship owners, and so on. How do you really work together as a team to put health into your tourism? And that's not something that persons always like to do because there's a cost factor. But what we're offering at CARPHA is let's do the training, let's put the systems in place free of charge. So someone comes, if someone does get sick, it's nipped in the bud. The other thing, if you have a healthier tourism product, you have a comparative advantage over any other product, so that gives the Caribbean a comparative advantage. Yes, it is a great opportunity because part of medical tourism is not just about having accessibility to expertise, but also having an environment for healing. And that's what the Caribbean can provide. The sun and the sand, but the serene environment and the nice warm tropical climate will all help towards healing, to be able to have that, going by the beach and staying for months while you heal, together with the expertise. So that requires, of course, investment with international bodies with the Caribbean to make medical tourism a more affordable, accessible, and tourism product that we can offer. I am a little bit biased. I like my margaritas actually instead of rum, but if I had to choose a rum, I would go with English Harbor. Well, I think we started with some of that too. Accessibility, affordability to the product, having a healthier, safer product, having a product that is more visible. The visitors must be able to, to be able to choose a destination, to be able to have a destination that is healthier, that's safer, that's more affordable, easy to get to. And those, to me, are some of the big challenges. The other challenge that is facing, the differences among our different countries. How do we bring that together? So, we're one Caribbean, many different experiences, but we're still about the Caribbean. You want to come to the Caribbean. What is unique about the Caribbean? It's not just about our sand and our sea and so on, but our different but unique cultures, our food, our people, our dance and music and all of those things that brings us together. And so those are our comparative advantages. But how do we take that and make that our advantage? I would say it's not just about our sand, our sea, and our nice tropical climate, but I would say it's about our people, it's about our culture, about our food, our dance, our music, all together combined. The Caribbean superpower is a combination of what we have. I think the people, the food, the culture, combined with this tropical climate. It's the mixture of all of this that makes us so different from the others. One Caribbean, many unique experiences.